For the first time ever, Manitoba has seen measles cases climb into triple-digit figures over just 1 month. That month was February, where 170 cases were recorded. And it's not the only concerning milestone being recorded. To explain, CTV's Harrison Shin joins us now live. Harrison, expectant mothers and babies in this province are also now finding themselves infected with this virus.
Now, that's right, Marilee. We've now seen 2 cases of congenital measles in Manitoba. Now, this is when a mother passes measles onto her newborn, which can lead to serious complications, even death. This as the tally of the virus in just the first 2 months of this year has climbed to 248, and that is a big number considering in all of last year we only recorded 319 cases. Manitoba is just 71 cases away from topping the entire 2025 number for confirmed measles cases.
Now we have had quite significant transmission over the past year here in Manitoba.
Dr. Santina Lee is a medical officer of health with the province.
In the last couple of weeks, we are continuing to see some other transmissions, some of them related to, second generation of cases, and some that aren't necessarily tied back to that event that occurred at the end of January.
One of those exposures was a possible super spreader event at Ag Days in Brandon. Lee says we are now outside of the time period where new cases can be tied to that event. As of February 28th, there are 248 confirmed cases and 36 probable cases since the start of 2026. Last year's total was 29 probable cases and 319 confirmed cases. Don Bowdish, immunology professor at McMaster University, says Canada already had 2 infant deaths due to congenital measles. In Manitoba, there have been 2 cases of congenital measles and 12 in pregnant individuals since February 2025. Even if the baby survived the disease,
the science shows us that very few of those babies reach their full intellectual potential because the baby's brain needs to be focused on growing and developing, not fighting a deadly infection.
Doctors Manitoba President Dr. Nichelle Desilets says Manitoba's healthcare workers are taking precautions, but she says many are women of childbearing age, so the worry is still there.
We know that measles is of a particular concern when it comes to exposure during pregnancy. So I am hearing from people that they're, concerned about what patient assignments they get when they go to work.
Now, just for context on how measles is exploding, Manitoba only had 18 recorded cases from January 2000 to December 2024. Manitoba is #1 for measles cases in Canada, which lost its measles-free status in November 2025.
Harrison, how can people protect themselves?
Well, first and foremost, check your immunization record and consult with your healthcare provider. Desilets says if you are thinking of having a child or already in early stages of pregnancy, it is a good idea to chat with family members to ensure that the whole family is protected against measles. And now, children aged 6 to 12 months can get a total of 3 dosages of vaccines if they live in Southern Health, Interlake Eastern, or Prairie Mountain Health regions. All other children 12 months or older are eligible to get 2 doses.
All right, thanks for this, Harrison.